Assalamu alaikum. I am Dr. Farhana Islam, Associate Professor, Gynae and Obstetric Department, Akizuddin Medical College, Khulna. Today we are going to discuss about the iron-deficiency anemia in pregnancy. In our country, iron-deficiency anemia is more common in pregnancy because there is an increased demand in pregnancy of iron, and our poor malnutrition or due to increased demand or due to malnutrition and presence of any infection, and in our country more common that there is an repeated pregnancy in too many frequent duration interval, so that we know about that between two pregnancy to replenish the stored iron need at least 2 years, and in our country due to low socioeconomic condition and malnutrition and another low education about the contraception, there is an too many child and too frequent interval, so that there is a chance of replenish of stored iron is less common, so that there is a chance of iron deficiency anemia. Because there is an in before pregnancy there is an anemia is present, and during pregnancy there is an increased demand, and only 18 to 20 milligram of dietary iron is daily absorbed, and in case of pregnancy the chance of absorption rises up to twofold, but demand is not fulfilled, so that there is a chance of iron deficiency anemia, and there is a poor diet containing of iron, and there is intercurrent infection, so that there is a chance of iron deficiency anemia also. And what are the signs, symptom of iron deficiency anemia? Patient came with anemia that she is easily tired and lassitude and fatigue, so that there is an on examination there is a glossitis, angular stomatitis, pallor, and there is a soft systolic murmur may present, and another is maybe crepitation because anemic heart failure is already present there, and all symptoms usually mimic the symptom of pregnancy, so that there is a chance of override the condition or maybe mimic the symptom. But to confirm the diagnosis, we should do some investigation. In case of iron deficiency anemia, we done some investigation to identify the case. To diagnose the case, we should do some hemoglobin concentration. Hemoglobin concentration means there is a severity of the anemia, like mild, moderate and severe. In case of mild anemia, hemoglobin concentration should be 10 to 8, within 10 to 8 gram per deciliter. In moderate anemia, the hemoglobin concentration should be 8 to 7 gram per deciliter. And in case of severe anemia, hemoglobin concentration should be less than 7 gram per deciliter. Now, to find out the cause of anemia, we should done some other investigation to identify the type of anemia, we should done some investigation like peripheral blood film and red cell indexes. Red cell indexes means there is an MCV, MCHC and MCH, and other is packed cell volume. In case of iron deficiency anemia, in packed cell volume less than 30%, MCV, MCHC and MCH all are decreased than normal, and we should do peripheral blood film. Then we found that there is an anisocytosis, poikilocytosis or any abnormal target cell. Those are the feature of iron deficiency anemia. Like size, volume, all are decreases in case of iron deficiency anemia. And we also done serum iron profile. Iron profile means ferritin level iron binding capacity. Those are iron binding capacity is increases why there is no iron in the body, so that in the blood, so that there is an binding capacity is increases, and total iron should be decreased, and ferritin, which is the store form of iron, which is also be decreased in iron deficiency anemia. And in red cell, these are the investigation done for differentiate the type of the anemia, and we should find out the cause of anemia, so that we should done some other investigation like why there is an iron deficiency anemia. We diagnose that this is iron deficiency anemia. Why there is an iron deficiency anemia? So to look after that, we should done the cause. Cause means we also described in previous classes that cause of the deficiency anemia is like there is any infection or any bleeding, like bleeding, piles, hook form infestation. So to differentiate, to find out the cause, we done urine for routine and microscopic examination to diagnose the urinary tract infection, and we do stool for RMA to detect any hook form infestation. And complication of the anemia in pregnancy. During pregnancy, there is a chance of preeclampsia. Preeclampsia occur due to hypoproteinemia, and chance of recurrent infection. Recurrent genitourinary infection more common because in anemia there is a loss of self-immunity. Immune response is low, so that there is a chance of infection. Recurrent infection is there. And another complication, grave complication, is cardiac failure, because of their chance of more common in 30 to 32 weeks of pregnancy. Anemic heart failure may occur during pregnancy, and there is also a chance of preterm delivery, prematurity. And during labor, there is a chance of uterine inertia. Uterine inertia occur due to a loss of muscle retractile capacity is lost due to anemia, so that there is an atonic uterus, chance of atonic uterus. And severe PPH may occur, and patient may go to in shock. And there is a chance of cardiac failure also during pregnancy and during labor also. And there is a chance of subinvolution or infection after delivery. In case of baby, fetus, in fetal effect are intrauterine growth retardation and chance of intrauterine death, which is more rare. It is occurred due to the maternal anoxemia. Anoxemia due to anemia, hemoglobin need for oxygen carrying in case of whole body, and when there is a low hemoglobin concentration, there is an oxygen concentration in the blood is also low. That means anoxemia, hypoxemia, which is leads to fetal anoxemia and may causes fetal death.